Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Over this last week, we've gotten a lot of questions about home tests, and I think it is pretty confusing. So we're going to spend a few minutes today talking about home tests, when you should use them, when you probably shouldn't, how to do it. We're actually going to do one here today, and then what to do if you get a negative result or what you do if you get a positive result. So these home tests are pretty good tests. They are antigen tests. And the way they work is they look for the antigen, the protein that's in the coronavirus or the COVID virus in your nose, and then tells you whether it's positive or not. Usually gives results within about 15 minutes, and the tests are quite accurate if they are positive. So if you have a positive test on a home test, you almost certainly have COVID. If you have a negative test, you probably don't, but still could have COVID because it may be too early. These tests don't usually show up until the first or second day of symptoms, or you didn't do the test right. It's pretty easy not to do the test right. So we'll show you today how to do the test. So what are the best times to use the test? Well, I think there are three circumstances where these home tests are absolutely ideal. One of these is if you've been exposed, you have symptoms, you think you might have COVID. In that case, it's very reasonable to do one of these home tests. Most people who are COVID positive, especially with Omicron, do not need to go to the doctor or go out to get a test. One of the home tests will really quite suffice. The second group that this is good for is if you've been exposed, you've been exposed to someone, you want to know later if you got it, 5 days after your last exposure to test to see if you got it. Now, I've had a bunch of exposures over the time, so I've used home tests a couple of times to check to see if I was exposed and got the disease, and thank goodness each of those times was negative. The third time when these home tests would be great is if you're going to be doing some activity which is high risk and you just want to be sure you don't have it. So I dearly want to visit my mom, and certainly before I go see her, I would do a test probably 5 days before and on the day of to be sure that I'm negative, because the last thing I would want to do would be to bring COVID home to my 92-year-old mom. So you can get these tests in a lot of different places. You can buy them at the store. I've done that a few times. The county got 15,000 tests, which we are distributing through rural fire stations and other places in the county. So if you have questions about that, we can let you know. And the third is the federal government is distributing those. So about 2 weeks, they came out with the way to get them, and I signed up. It's a very, very easy sign up, and we'll put the address on the screen later. And it arrived in the mail on the 4th. In a packet like this, and in this were two of these home test kits. Each of the kits have 2 tests, so a total of 4 tests per household. It was actually incredibly easy. Even I could do the ordering. Well, these tests here come in a box, and in the box comes 2 vials, 2 test kits, 2 swabs, and really confusing directions. So we're going to show you today how to actually do this. So to do this, what you need to have is you need to have one of the tubes, one of the cards, and one of the swabs. Now, sometimes tests are a little bit different, but pretty much they all follow the same thing. And then here are the instructions. So the instructions say, get ready, have the test card, the pre-filled tube, and a swab. Open the pouch, take out the test card in the pouch. So the test card looks like this. These are fairly typical for what these kind of things look like. And these are the kind of tests that we use a lot in medicine. We use these for strep, we use these for flu, we use these for pregnancy tests, and they all work the same way. So then we have this vial here, and this seems like it's going to be the most complicated part of just getting this open. There we go. And this one has a tube, a cap, and then this tiny little vial in here. So this tiny little vial is not always easy to use. Please look carefully. There are 2 edges on the empty tube. So here's the Here's the empty tube. Now, you would think when they put these things together, they'd make them a little bit more stable. It's got the tiniest little base on it, but nonetheless, we're gonna see how this works. So what we're gonna do now is we're going to twist this, and as we twist this, there's some liquid, and then we're gonna put the liquid in here. And it's supposed to go to the first line, and this one then does go to the first line. So I think I did this step correctly. Put the cap on, because I imagine if you don't put the cap on right now, you are certainly going to tip this over and have it all over the table. You really think they could have had a better base to put this in, but oh well. Okay, now the next step is to collect the swab, and this is the place that I think most people are getting it wrong. And I think they're getting it wrong because they're not being aggressive enough in doing it. I've actually watched once or twice as people do this, and they're clearly not doing it right. So here's a Q-tip that comes with this. It's got the cotton about 5/8 of an inch at the end. You're supposed to put it in your nose 3/4 of an inch, which is further than the swab is, and you're supposed to be doing it for 15 seconds. And so, you know, a lot of people do this, okay, I'm done, and then put it in there. That is not going to work. You really need to take 15 seconds on each nose, each side of your nose. So it's going to really take a while. When we do these for strep tests, we go in people's throat. A lot of people just go right in, and they say, well, I never get a positive. Well, you really have to, when you're doing a throat swab, really make people gag. And this one, it needs to be in long enough that it really is, it's a long way. So let's count here as we do this. Okay, that was 15 seconds on each side. It seemed like an hour, but it indeed was. Next thing you're supposed to do is just so take this and tamp it down so that all the liquid is at the bottom. Then you're supposed to take off the orange cap. Put that to the side here. And then you're supposed to put this in and rotate 15 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then I think this is the part that most people struggle with, is squeezing as much of the stuff out of the swab as possible. So what you need to do is you need to, with your fingers, squeeze tight and turn this so that you can get all of the goo and all of the liquid out of the swab. I think I've done it. We then put the orange back on. And now there's a tiny little cap on the top. We take the cap off. It certainly seems they could have made this easier. And then what we're supposed to do was also drop 3 drops in there. So if you don't put enough in there, it doesn't work. If you put too much in there, it may not work. So really want to do 3 drops. So now is the most excruciating time, which is waiting 15 minutes. So 15 minutes seems like a long time, but you really need to wait 15 minutes because sometimes it's hard. You'll see in the beginning, there's a wave of color across, and that wave of color across is the liquid moving across, but it's not really until bright lines develop that we have an answer. Okay, so now you have 15 minutes to wait to see if your test is positive or negative. So what do you do if your test is negative? Well, if you have symptoms and your test is negative, that's a good sign. Pretty good sign that you don't have COVID, but we still aren't sure because as I said on the first or second day, these don't always show up. So if your test is negative, that's a good sign, but I would wait another day or two and then repeat the test. If the next time the test is negative, so if it's negative twice and your symptoms are improving, you're good to go back to work. If you're symptomatic and it's positive, then you got it. there are almost no false positives on this test. So there really is positive, then you should consider that you have COVID. Well, if you're mildly ill, there's not much to do. 5 days from the onset of symptoms or from the test, you should stay home. You should isolate yourself because that's your contagious period. Stay home and not give it to others. You should also call us at Douglas Public Health Network at our hotline at 541-464-6550. And stay home for 5 days. 5 days after the test, if your temperature's down and you're feeling better, you should no longer be contagious, and you can go back to work using a good mask. Now, if you were using this to see if you were a contact of a case and 5 days elapse, even if you don't have symptoms, if it's positive, you got it, and you should do just as you did. It was a positive test. Call DPHN, stay home, and try and prevent others from getting it. If after 5 days it's negative, that's a pretty good sign that you didn't get it, and you can resume your normal activities. If you're using this before something like visiting your mom, if it's positive, you almost certainly have it, and please cancel the trip. The worst thing to do would be to go and to expose somebody else to the disease. If it's negative, that's a pretty good sign that you don't have it, and you can visit with a little bit more confidence. So we've waited our 15 minutes now, and we can take a look at our test results. So here are the test results, and you can see that there is one very distinct line under the C. That means that the control is positive, meaning that the test worked well, but the T is negative. There's no line under the T, meaning that this is a negative test. If there was a line under both the C and the T, that's a positive test. And if there's no lines, it means the test didn't work and you can't rely on the results. So again, this is what we would hope that most people would see. A line under the C, meaning that the control worked, meaning the test worked, but nothing under the T, meaning that the test is negative and the person who did this test does not have COVID. Pretty easy to do, but you really do need to follow the steps in exactly the correct order to get this right. Again, so when should you use the test? You should use the test if you have symptoms, think you might have COVID. If it's positive, you do. If it's negative, repeat the test in 2 days. If you've been exposed to somebody who's had COVID, test 5 days after the last exposure. Or if you're doing some kind of high-risk thing like visiting your mom, you should go ahead and do the test on the day that you're leaving. If you're positive, call DPHN at our hotline at 541-464-6550. Stay home and don't expose others. If you call the hotline, they'll tell you how long you need to stay home. And let's get through this whole COVID thing. I think home tests are one of the ways that we can help to get through this and help to not expose others if we get positive. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thanks.